Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today let's use this episode to talk a little bit about the recent accusation that the CDC quietly altered their numbers regarding deaths caused by COVID-19, and that actually only 6% of the deaths were caused by COVID, and the other 94% were caused by something else. First, let's talk about death certificates and how they're filled out. Surprisingly, death certificates can be difficult to complete, and one study I read showed that up to 30% of death certificates are not completed accurately. Here's an example of a sample death certificate. As you can see, there's a Part 1 and Part 2 on the certificate. Unless someone has been murdered, been involved in a deadly accident, or committed suicide, underlying causes are expected to be given. It's rare for any that I filled out to not have health conditions such as diabetes and high blood pressure that contribute to the death. These are usually placed in Part 2 of the death certificate. But Part 1 is more complicated. It is expected to have a chain of events starting with the underlying condition. For example, atherosclerotic coronary artery disease caused the coronary artery thrombosis that then caused the myocardial infarction or heart attack that then caused the fatal rupture of the myocardium. You can imagine how complicated these can be. So an example with COVID-19 is that COVID-19 caused pneumonia, which then caused advanced respiratory distress syndrome, which was the final cause of death. At the end of the day, the data is only as good as the death certificate. So let's go back to the theory that the CDC has quietly changed its data based on a tweet that said, quote, "This week, the CDC quietly updated the COVID number to admit that only 6% of all of the 153,504 deaths recorded actually died from COVID. That's 9,210 deaths. The other 94% had 2 to 3 other serious illnesses, and the overwhelming majority were of very advanced age." Some claim that this is an indication that the pandemic is not as severe as public health officials have said it is. To that statement, I would simply say the 6% that reflected COVID as the only cause of death on their death certificate were either filled out incorrectly or were in patients very young or very healthy without any other underlying conditions, because it's really rare to not have underlying conditions such as diabetes, high blood pressure, or obesity, especially as we age. When you look further at the data, those 94% that listed other underlying conditions on the death certificate, almost all of them listed COVID-19 as the underlying cause of death. But if you're still skeptical, then I want to shift to another way to determine deaths from COVID-19, and this is by using the excess death rates. Using statistical models based on mortality data from the past 3 years, projections are made for the upcoming year, and the number of excess deaths is the difference between the model's projections and the actual observations. Starting in mid-March 2020, there was a spike in deaths that has continued to be present. The cause for this spike can only be attributed to COVID-19, since there are no other reasonable causes for this spike. As we move into the flu season, this may be more difficult to tease out because we have seen other times with excess deaths. The last period occurred in December 2018 through January 2019, when there was an unusually deadly flu strain. So for those who are concerned that we are undercounting or overcounting the COVID-19 deaths, I think at the end of the day, a good way to look at how well we are doing is to compare the numbers we're obtaining with death certificates to the excess deaths compared to this time last year. The excess deaths so far are calculated to be about 200,000 at the end of July, whereas the actual deaths attributable to COVID were reported to be 150,000. We know that the data can take up to 1 month to report, so that may be one reason for the difference in the numbers. We'll have to wait to see if these numbers become more similar as the data comes in. But for skeptics, the numbers being reported may actually be lower than the actual number of deaths from COVID. So at the end of the day, no, I do not think the CDC is trying to mislead the public with their data. You just have to understand what the data is saying and the limitations that the data have. Thanks for joining me.